Right.
Tell us a little bit more about Dr. Taney, David.
Well, pardon me if I have to read just a touch. This man is so full of credentials and good stuff that it's amazing.
I hear he's a good golfer, too.
Okay. He's past president of the Broward County Ophthalmology Society, the American Academy of Ophthalmology, the American Society of Retina Specialists, Palm Beach and Broward County Ophthalmology Society, and the Fort Lauderdale Caducean Society, and is fluent in Spanish.
Correct.
Okay. Vitreoretinal retina specialists are ophthalmologists specializing in the treatment of retina diseases, including age-related macular degeneration, retinal detachment, macular holes, diabetic retinopathy, and complex retinal diseases, including advanced retinopathy of prematurity, cancers of the eye, complex surgical disorders, as well as genetic eye diseases. For those of you out there that didn't follow all of that, that's okay, because neither did I. But it sounds very, very important. And, Doctor, welcome to the show. Paul?
Thank you. And Dr. Taney, thank you so much for being with us today. You're coming from the Delray office today?
Yes, I am. We have offices all throughout South Florida, and this one was just opened recently, actually this week.
Oh,
Congrats.
Congratulations.
We offer services of retinal diseases throughout South Florida.
Well, we appreciate you taking time away from the family and the practice to be with us.
And the boat.
And the boat.
Right.
Let's really start at some very, very basic things for our audience who may not be as sophisticated in all of the things that David just elicited. Talk a little bit, if you will, about the retina and what it does, and without the medical 101, why is it so important?
So the retina is basically one of the most important parts of the eye. It acts as the camera and the film. And so if you think of the eye as a camera with a lens, which would be a lens which is in the front of the eye, the cornea, which covers the lens, and the retina lines the entire back part of the eye, acting as the film of the camera. It receives light impulses and chemically transmits these light impulses to the brain and creates a picture for us. So the retina basically is extremely important. If it does not work, the camera doesn't work, the eye doesn't work, and people have vision problems.
Thank you. David listed a whole host of diseases that the retina and the specialists at Florida retina specialists deal with. Talk a little bit in very generic terms about what are some of the problems that you see day in and day out.
Right. Doctor, I need you just to get a little closer to the microphone. Okay. Thank you.
So,
because it's too important to miss.
You were talking about caregivers, and we deal with this all the time, probably very frequently in South Florida, more so than other parts of the country because of all the retirees. We deal with macular degeneration, which is a deterioration of the central part of the vision, making people's vision difficult, with difficulty in reading, seeing faces. And one develops blind spots or pieces of the picture missing. So simple things like reading, driving, watching TV, seeing a loved one's face all become progressively more difficult.
Is that almost like when we see on a television screen it gets pixelated and you can't see it, or is it actually a black hole?
It's more, well, in the worst stage, it is actually a black hole. But the best analogy would be if you took some Vaseline and put it on your glasses.
Oh, yeah.
And you see a smudge. And that's how it starts up. And we deal with macular degeneration day in, day out. And we have a lot of family members bringing their loved ones in who are becoming progressively more feeble, more disoriented, having more problems with life as this disease progresses. We also deal with diabetes, which if untreated, can cause similar problems with this blurred vision and actually loss of vision in the advanced stages of the disease. We deal with retinal tears when people have floaters and flashes. We hopefully can see them before they develop a retinal detachment, which would be the next stage of the disease after a retinal tear develops.
Doctor, floaters and flashes, give our listeners an understanding of what that might look like.
So a lot of people say, I was driving and all of a sudden I saw a shower of bugs, or I could have sworn there was a bug in front of my vision.
Great.
And I tried batting it away and it wasn't there. And sometimes it spread out like ink in a glass of water.
You mean
and
murky?
Murky.
Yeah.
And other times I had it for an hour, for a day, for 2 days, and it went away. So I didn't think much of it.
Right.
And
Sure.
by the way, all of my friends told me, oh, I had that too, don't worry about it. It can also be associated with flashing lights, which signifies pulling on the retina. And that is more worrisome because that's often associated with a retinal tear.
I see.
Wow. David, do you have something?
Well, as far as we always come and see people. It's like caregiving when their hair's on fire. When all of a sudden our vision has gotten a lot worse. And so most of us that wear glasses and we traditionally go to the optometrist who tells us whether or not, our eye pressure is good and what it looks like. But in a more preventative sense, what can one do, if anything, proactively to kind of stave off some of those retina degeneration issues, if you can?
Well, lifestyle is always the most important thing. Eating well. Smoking is a definite risk factor. If you're out in the bright sunlight, wear ultraviolet blocking glasses. Eat a lot of vegetables, green vegetables in particular, not a lot of fat. And for people who have been diagnosed with macular degeneration, a certain subset of those people will do better with specific vitamins.
Okay.
Okay.
One question, because my father had it. Is it inheritable? Is it a genetic pass along, or is it luck of the draw?
I read a statistic recently that if your parents had advanced macular degeneration, there is almost a 50% chance that you will have some form of it.
Another gift from Dad.
Exactly. If your parents didn't have it, there's only about a 10 or 12%. But as one gets older, for the age group 60 and older, 10% of people have macular degeneration. And as one goes up to 80, it goes up to about 30%.
Pretty high. Your practice is a physician referral practice, and that's a relatively new term. Can you describe what that is? How do we get in to see you?
So the field of retina surgery and disease is a relatively new field of medicine. It's been around in the scheme of things for about 30 or 35 years. And we see people who know they have a retina problem or look up on the internet their symptoms and figure out that they have a retina problem. But more importantly, we see people who are referred by optometrists who are very competent in diagnosing these problems, and ophthalmologists. So they will make the referral. Also endocrinologists and rheumatologists.
Diabetes specialists.
Yes, diabetes specialists and people who specialize in arthritis because certain arthritis diseases cause problems in the eye. So it's a broad spectrum of
That's a
of
very
referral
interesting
sources.
piece of information. The rheumatoid arthritis or just arthritis in general?
More rheumatoid arthritis and more specific, rarer diseases.
Okay.
Well, I know for one of the medications that Debbie takes, she has to get field of vision tests done twice a year. So it is important.
Right.
all of the doctors at the Florida Retina Institute are board certified, and we see board certified, I guess,
In lots of
lots
disciplines.
of fields. Tell us, what does that actually mean? And really, for our listeners out there, why is it important that they search out those type of doctors?
So board certification is just another quality indicator that you've met some rigorous standards as far as your training and basically passing very thorough written and oral examinations with examiners.
Mm-hmm.
Now, there is, interestingly, no board certification for retina.
Just for
there-
ophthalmology?
Just for ophthalmology.
Huh.
And that's a long discussion in itself. But there are certified vitreoretinal fellowships. So a retina specialist does ophthalmology first, gets training and board certification in ophthalmology, and then goes on to do training in vitreoretinal surgery and
typically,
disease.
how many years is that, doctor?
It's a total of, after medical school, 6 years.
Wow. And didn't you tell us outside that your daughter has
Yes.
just become is a
Yes.
retinal specialist?
Yes, I guess I did something right. Yeah, my daughter, when she was young, we would see emergencies on the weekends, and she would come into the office and say hi to the patients and kind of stand in the back and saw what was going on. Anyway, she decided to go to medical school and fortunately decided to do ophthalmology, and even more fortunately decided to do retina. So she just finished her fellowship and just started her practice 2 months ago.
Oh, but you said she's not a part of your practice. She's up in Washington, you said?
No, she's in Washington, D.C.
All right. And probably for a while that's a good thing.
We'll see.
All right.
Well, it's good to
But-
it's good to
You know,
have
it's
an
good to
instant
hang out with
consult.
Dad,
Yeah,
of course, but
Right, we go to conferences together. She calls me for opinions about cases
all right.
and sends
Well,
pictures.
Nothing like Dad for a
and-
second opinion.
Yeah, it's great.
That's great.
The technology has changed so dramatically, and I know especially when you're talking about the eye, you're really talking about small places and difficult things. Tell us a little bit about the technology that you use in your practice.
So ophthalmology, by necessity, deals with very small spaces, from cataract surgery to retina surgery. And the field of retina really, as I said, has only been around for about 30 years and basically grew with the invention of small micro instruments that are placed into the center of the eye. And these instruments illuminate, they cut things, we're able to grasp things, really working at the level of microns. The retina is only about 200 or 250 microns. That's a quarter of a millimeter thick.
Wow.
Wow.
And we have instruments where we can go on the surface of the retina and peel things off of the retina, grasp foreign bodies. If somebody's in a car accident, we can go and take things out of the eye that are underneath the retina. So it's really, it's quite a advanced field. We have,
Needless to say, you have a steady hand.
yes, hopefully. We have instruments. The most exciting recent one is a instrument called OCT, which is basically optical coherence tomography. And what it does is it shines a light beam in through the front of the eye, reflects it off the back, and then a computer processes the information and is able to do an optical cross-section of the retina.
Wow.
And the resolution on that is about 10 microns. So with that, we're able to fine-tune our diagnosis of the diseases and the treatment of disease.
So you see things deeper into the retina than you heretofore might have been able to?
We see things deeper within the retina, and we see things that are within the retina much better than we were able to just with the naked eye.
That's amazing.
Wow.
It really is.
All right. I
And
think
we tailor our treatments for in macular degeneration and in diabetes and in surgical planning using this instrument. And recently there was a further refinement of this instrument. I think it was just FDA approved, where you can attach this instrument to the microscope when you're doing surgery in the eye, and it will help you
wow.
make good surgical decisions.
I think when we were talking outside earlier, and I said to you, is there a Da Vinci machine, which for those of our listeners is kind of a robotic surgical instrument. It's being used a lot these days in laparoscopy and micro type surgery. But you said that more than likely the Da Vinci machine came out of what was going on with these micro instruments that were being placed in the eye by specialists like yourself.
And by necessity, we had to get into small spaces.
Right.
And we used small illuminated fibers and small instruments, and we do it the same way the Da Vinci machine does it.
All right, so the
except
light
we
went
don't
on
have
for somebody.
And there have been experiments with robots for the eye, but so far nothing.
All right. Still takes the doctor's hand and eye. Huh?
Correct.
Doctor, you mentioned earlier about people experiencing floaters or incidences in their eye that come and go. Tell us a little bit about what they need to be looking for and when they really should get to the doctor, and when should they take this a little bit more seriously?
Well, the normal aging process involves shrinkage of everything in the body. Changes in the skin, changes in the collagen, and the center of the eye is filled with a jelly called vitreous. And the vitreous undergoes changes and goes from a nice, smooth, gelatin-like material to more of an egg drop soup material. And
For those of you who are Chinese food eaters.
correct. And as it goes what we call this liquefaction, becoming more liquefied, it shrinks. The problem is that the vitreous is attached to the retina. It's almost like a soft-boiled egg, where the vitreous is like the yolk of,
Okay.
the egg, and the retina is the white of the egg. And it's attached, so as it shrinks, it rips the retina. And that's what causes retinal tear and retinal detachment. So if somebody, especially if somebody is nearsighted, they're at higher risk. If there's a family history of retinal detachment, they're at higher risk. But if somebody does develop floaters, I think it's a good idea that they see one of their eye care providers.
Okay, well, that's probably good advice anyhow. Normally, we see our optometrist if we have glasses, but it's probably a good idea to have an annual eye checkup regardless.
I think it's a very good idea because there are certain diseases of the eye that sneak up on you, such as glaucoma. It's only at the advanced stages of glaucoma, when there's loss of your peripheral vision, that you even know you have it. So that's very important. The other thing is people, as far as the retina goes, when they develop things like macular degeneration or diabetes, they say, I just need a new pair of glasses. But really, that's not the case, because glasses won't fix the problem. It's a problem with the retina or the receptors. That's the problem. And therefore, if somebody's vision is not good, or there's a change in vision, if there's distortion of the vision, it's important that one sees the eye care provider.
All right.
And take it seriously.
And take it seriously.
Well, you only get 2 sets and one time around with them, as far as eyes are concerned.
Speaking about caregivers, as people get older and they become less communicative, they often will have these issues, but they won't communicate.
It's not articulated.
Correct.
All right.
And the caregiver will come in and say, it's just not doing this or not doing that. And then a big problem is found, but the more elderly person won't articulate that.
Right. And so caregivers have to be not only reactive to what they see, but proactive and we're talking now about a caregiver for an older person, has to be proactive for some of the normal diseases of aging, especially related to eyes, because that's an essential quality of life. And your connector, when you are not necessarily hitting on all 8 cylinders, still to be able to read, watch, hear television, whatever it may be, and you lose that eyesight, it's gone.
Well, let's follow up with that. Fear obviously has to be inherent for all of us that would have difficulty in seeing. You use the word blindness, it's permanent. How do you address that when somebody comes in and they're very fearful about what's going on? Talk a little bit about that.
Everybody's very fearful when they have eye problems, especially people who have had a problem in a fellow eye and can't see well, and then their only good eye begins to develop problems. And I think it's just a question of being very calm and reassuring the patient that we have a lot of tools at our disposal which we did not have as early as 5 or 10 years ago, which we can now use. The drugs that we use to inject in the eye are much better. They were actually non-existent before about the year 2000. The instruments that we use now are the size of a little more than a hair, but they're very, very small. We use micro-incision surgery now. People heal very fast. We can do a lot of things with chemicals which we use to hydraulically attach the retina, which were non-existent in the past. So even though when you have a retina problem, it's a significant problem, there should always be hope.
And I think really the takeaway is so much more can be done today than not that many years ago.
Absolutely.
So if you were kind of written off a couple of years ago, it might be a good idea to go back and see what the science, et cetera. You're giving me that maybe so, maybe no.
Basically, there's a time issue with a lot of eye problems. So what you lose, often you can't get back, which is why it's important to be proactive,
Right.
as you said.
All right. When we were sitting outside earlier, I said to you, what was the Caducean Society of Fort Lauderdale? And you told me what it was, and I found that to be kind of fascinating. Could you touch on that?
So the Caducean Society of Fort Lauderdale was founded 35 years ago by a group of doctors in Fort Lauderdale who were interested in learning about the other's field. And one of the issues when you are in a very subspecialized specialty is that you tend to have blinders on. You don't really know what's going on with the rest of medicine. And that's not great, because the part about being a good doctor and a complete doctor is to know what's going on with the rest of medicine. And you know what? You might get a good idea that you can apply to your patients. So basically, it's a group of 30 or so doctors that have dinner once a month, and everybody gets together and they go around the room and you stand up and you talk about what is new and exciting in your field for a few minutes or 5 minutes.
That's a great idea.
That is, I think that's wonderful. And
It's very stimulating, and it's what medicine really should be about.
well,
David,
I applaud that effort.
Many of our listeners, as you know, are in rural areas or they're not so accessible. And we're really talking about a very unique specialty that Dr. Taney is involved with. This is the kind of a thing that if these kind of problems exist and your ophthalmologist is giving you this advice and saying this is the issue, these are the kind of doctors that you search out. You come to a place like the Florida Retina Institute, you search out those specialists that are going to be able to do this. You only get one chance of getting your sight.
Well, you're absolutely correct. And doctor, besides you and your daughter, how many retina specialists, vitreoretinal specialists, are there, even though we don't have a board certification that kind of aggregates them. But
I actually would have to look that up, but the largest organization in the world of retina specialists is called the American Society of Retina Specialists. And I think it has, at my last count, which may not be totally accurate, somewhere about 2,500 members.
so if we were to spread them out equally, that's only about 50 per state.
Yes.
All right.
Correct.
And obviously they're aggregated in urban areas a lot more than they are
That's very
in
true.
rural areas. But if somebody has been told that their eyesight, which is critical, is being compromised by a retina issue, et cetera, it would probably behoove them to go and seek out. Is there a directory from that organization of
there-
where specialists are to be found?
There is a website, and I think there is something on the website where you can find a retina specialist near you.
Okay. Do you do any telemedicine in terms of consulting? I mean, do you get on the internet perhaps and at least give somebody an understanding of what they may have, even if they can't get to you?
The answer is not formally, but there are people who are exploring the application of telemedicine. And the images that can be captured with devices now and transmitted over the internet are quite good. Although
If you don't have the
goes-
hands and tools
it goes
to do
back
it,
to the
yeah.
old saying: if you have one image, it's only a piece of the puzzle.
Right. And
So
quite frankly,
it's
even if you've told the ophthalmologist in Podunk what's going on, if he cannot perform the surgery or if there's nobody that's in the area, it's information.
Correct.
And-
But
right.
there have been studies that have shown that there is a future for telemedicine, that the pickup rate is very significant.
All right.
Plus
Well-
the flow of information. People
Well, but
realize it.
when you stop to think about this, what was it, CT,
OCT.
OCT?
Yeah, those can be transmitted over the
Right,
internet.
and so that image should be transmissible, and so I guess that allows specialists like yourself at least to weigh in
Correct.
for somebody that may not have
Correct.
that knowledge, and at least give some good advice, including get out of Dodge and
Correct.
come to Florida.
Yeah.
Dr. Taney, if I had been referred to you by my ophthalmologist, what is it you'd like to see me and perhaps my caregiver, if I had a caregiver, bring to the office, and what type of questions should they be asking?
Well, the main thing really is to bring yourself.
Right.
We always would like to have a medical history, know what drugs you're on, because there can be some drug interactions in the eye. We'd like to know if you are on blood thinners, because certain bleeding problems in the eye can be aggravated by blood thinners. There are some toxicities of certain drugs. And we'd like to know from the caregiver how the person's behaving. What does the caregiver think the problem is?
All right. Well, that's a very good first start. all
Boots
right?
on the ground.
Boots on the ground is absolutely, and as you said, you got to bring the eyes in, but having somebody that can also illuminate or be clearer about what they may be experiencing if they, for argument's sake, because of dementia or some other issues, can't articulate clearly. I'm
Correct.
sure that it has to be a little bit back and forth of,
Correct.
just from the old click, is this clear or is that clearer?
Right,
If you don't say yes, it's kind of hard to fine tune it.
So we make an appointment, we visit the office. Typically, it would be about a consult first, and then a course of procedures or action.
Correct. You come into the office, we take the vision like anywhere else, we check the pressure, and then we see you and examine the eye with a dilated exam, which is critical to really know what's going on. And it's most important what's at the other end of all that equipment, trying to figure everything out. And then we can do tests called OCT. We do a test where we inject a dye into the vein of the arm, which allows us to check out the circulation of the retina. We can see if there's something growing underneath the retina. We can see if somebody has a tumor, what the blood supply is to that tumor. We can evaluate with a new technique called autofluorescence, which is a special infrared camera, certain reflectance patterns to the retina, and hone in our diagnosis.
Wow. So I guess as science improves and the technology advances, it gives you a greater opportunity then to fine-tune what you need to do, and it
Correct.
probably saves a lot of what earlier may have been, respectfully, a little bit of hit or miss. It's much
Correct.
more finite and precise.
Right, and I think the key word here is that it's a very objective assessment of what's going on, where there's still the art of medicine, but we have with us a lot of tools that make it
The science
much
of it
more-
better.
Much better.
All right, I didn't mean to finish your sentence. I apologize.
And most of the procedures that are done, or what is done in the office, is usually they go home the same day.
Correct. Most of the treatment that we do for macular degeneration and for diabetes is done in the office with either injecting chemicals into the eye or lasers, which are done in the office. If somebody requires a surgical procedure for advanced diabetic retinopathy, or a hole in the retina, or scarring of the retina, or a retinal detachment, then they have to go to the operating room. It's done as an outpatient procedure 98% of the time. It's usually done under local anesthesia, more often nowadays in a surgery center versus a hospital, and the patient goes home a few hours later.
That's
Wow.
amazing. And what about the caregiver in terms of aftercare?
The aftercare in retina surgery is fairly easy, except for one thing. And sometimes we put gases in the eye to blow the retina back into position to allow the retina to heal, in which case people have to position sometimes. So we'll say either look down, or lie on your left side, or lie on your right side, or sit up. The idea being that we will float whatever we put inside the eye
Back into position.
To reattach things and let things heal.
Right. That's not so easy with somebody who's
It's-
a little bit
it's-
older and may have
that's
some
correct.
cognitive issues, et
Correct.
cetera. So,
And we actually have, we use, it's called silicone oil for cases like that where somebody can't position, where we actually fill the eye with a bubble of silicone to just keep everything in place. And that can either stay there forever, it's crystal clear, or we remove it a few months down the road.
could it be a substitute for vitreous humor?
The vitreous is a substitute for vitreous humor, and the vitreous is really only necessary for the formation of the eye
I see.
when you're an embryo.
Okay.
Once you're born, everything that was going on to form the retina and to form the lens and to form the iris, the eye is filled with a mound of blood vessels, and as you mature and reach gestational age, or when you're born, that all regresses.
I
And
see.
the vitreous is just a clear jelly.
Gotcha.
So you can remove it and not have any
Negative
Negative
consequences
effect.
per se.
correct.
Okay. Your eye won't collapse.
Yeah.
David, believe it or not, we're rounding out this
Wow.
hour. It has gone so quickly. Dr.
We
Taney,
have to have you back. 'cause
Yeah, for sure.
I have a slew
My
of
pleasure.
questions.
but before you do leave,
Yeah.
what would you like our listeners to, as a takeaway, to retain? What would you like to tell them?
What I'd like to say is that eyesight is precious, and good vision shouldn't be ignored. People love to procrastinate.
Oh,
and
yes.
say, oh, yeah, it'll go away. I don't have to do anything. But if there is something going on with your vision, it's much safer and smarter to go see somebody who's qualified to assess it. And if it is nothing, well, then that's great. But if it is something, the earlier it's dealt with, the better the outcome.
Great. And so I'll ask Paul's question. if somebody wants to get a hold of you at the practice, what's the number? Because Sharon wants me to make sure that everyone knows how to get a hold of you.
We are on the internet, Retina Group of Florida. I think it's rgfla.com. And we have offices in Fort Lauderdale, Hollywood, Boca Raton, Boynton Beach, Palm Beach.
Okay, so
up and down the coast.
you're everywhere that somebody needs you to be.
And I don't remember every number.
You don't have to, but
And there's an event coming up, David, on Saturday the 31st, Foundation Fighting Blindness annual seminar for low-sighted and for patients and caregivers, and it's at FAU in Boca Raton. And I understand 4 of your doctors are going to be there.
Correct. We've partnered with the Foundation for Fighting Blindness for well over a decade. And our group has been involved in over 50 clinical trials, some of which have resulted in drugs which have really revolutionized retinal care.
well, doctor, I'd like to thank you
Yeah.
that